Question 221. A 4-month-old infant returned immediately from operating room from cleft lip repair. So which of the following nursing intervention should be considered here? So option A, apply the elbow restraint. Option B, apply suction when needed. Option C, measure the oral temperature frequently. And option D, put the infant in prone position. So option A, apply elbow restraint is correct answer, because elbow restraint commonly used for 2 to 4 weeks after cleft lip repair to prevent the infant from touching or damaging the surgical site. Question 222. Thermoregulation of the newborn is always a factor that the nurse should keep in mind. So when bathing a newborn baby, so which of the following mechanism of heat loss can lower the baby temperature during bathing? Option A, conduction. Option B, convection. Option C, evaporation. Then option D, radiation. So option C, evaporation is correct answer, because evaporation in newborn is a major source of heat loss immediately after birth and following bath, so occurring when the amniotic fluid or water on the skin convert to gas. Question 223. An increased risk for the sudden infant death syndrome is associated with the infant in the wrong sleep position in the crib. So which of the following position should the infant be placed in the crib to lower the risk of SIDS? So option A, back. Option B, prone. Option C, left side. And option D, right side. So option A, back is correct answer, because sudden infant death syndrome is unexplained death, usually during the sleep, if the infant sleep in the incorrect position. So it can be avoidable by using the ABC of the safe sleep. So A means alone, do not leave alone in crib. B means back, always place the baby on their back. C means sleep in crib with the hard mattress. Question 224. Nurse's action plays an important part in limiting the infection in the newborn. So which of the following nursing action help to prevent infection in newborn? Option A, washing hands before and after handling the newborn. Option B, thorough washing of the hand only at the beginning of the shift. And option C, using a special gel to disinfect the hands throughout the day. And option D, limit the use of infant supplies such as the diaper cream to 2 infants per room. So option A, washing the hand before and after handling the newborn is correct answer. Question number 225. Which of the following is a drug of choice to treat the convulsion due to eclampsia? So option A, diazepam. Option B, midazolam. Option C, valproic acid. So option D, magnesium sulfate. So option D, magnesium sulfate is correct answer, because eclampsia is a life-threatening complication characterized by the onset of clonic seizures or coma in the women with preeclampsia. Question 226. Which of the following breathing type is considered a respiratory distress and require the immediate action? Option A, stridor. Option B, rhonchi. Option C, wheezing. And option D, pleural friction rub. So option A, stridor is correct answer, because stridor is a high-pitched turbulent musical sound caused by the narrow upper airway. Question 227. A patient is recently diagnosed with herpes zoster. So the nurse establishing the care plan would most likely assign the highest priority to which of the following nursing diagnoses? Option A, anxiety. Option B, acute pain. Option C, social isolation. And option D, peripheral neurovascular dysfunction. So option B, acute pain is correct answer, because herpes zoster or shingles is a painful blistering rash caused by the reactivation of varicella zoster virus. It typically appear as a single strip on one side of the body and often accompanied by the burning pain, itching or tingling sensation. Question number 228. Physician order lactated ringal solution to infuse at 125 ml per hour. So which type of solution is lactated ringal? So option A, hypotonic. Option B, isotonic. Option C, hypertonic. And option D, hyperelimination. So option B, isotonic is correct answer. Question 229. Which of the following steps of the nursing process involve the performance of the nursing plan of care? So option A, assessment. Option B, diagnosis. Option C, implementation. And option D, evaluation. So option C, implementation is correct answer, because implementation is the 4th action-oriented step of the nursing process, where the nurse executes the established plan of the care to achieve the patient goal. Question number 230. When assessing a physician with an abdominal paracentesis, so the nurse should place the patient in which position? Option A, semi-follower. Option B, follower. Option C, tender work. And option D, prone. So option B, follower is correct answer, because in case of abdominal paracentesis, follower position is correct answer. Question number 231. Which of the following terms the nurse used for explaining the normal respiratory rhythm and depth in the patient? So option A apnea, option B eupnea, option C bradypnea, and option D tachypnea. So option B eupnea is correct answer. Question 232. A critically low value of which electrolyte will cause the cardiac arrest? So option A sodium, option B chloride, option C calcium, and option D potassium. So option D potassium is correct answer because imbalance in the potassium can lead to cardiac arrest. Question 233. Which of the following file section used to document routine nursing care such as bathing and oral care? So option A cardex, option B care plan, option C checklist, and option D medication chart. So option C checklist is correct answer. Question 234. Which of the following medication frequency abbreviation required the nurse to administer at bedtime? So option A HS, option B STAT, option C TID, and option D PRN. So option A HS is correct answer. Question number 235. What does the pathogen do in the reservoir within the chain of infection? Option A enter, option B survive, option C exit, and option D multiply. So option D multiply is correct answer because reservoir is the first crucial link in the chain of infection representing the natural habitat where a pathogen live, grow, multiply, and which can be a person, animal, or environment. Question number 236. Which of the following pulse is most commonly assessed? Option A apical, option B radial, option C femoral, and option D carotid. So option B radial is correct answer. Question number 237. What major factor should alert a nurse to discontinue the sponge bath to an infant who is febrile? So option A shivering, option B tachycardia, option C mottling skin, and option D increased respiratory rate. So option A shivering is correct answer. Question number 238. A patient with liver disease is receiving a lactulose enema. So what is the classification of this type of enema? So option A feeding, option B cleaning, option C medicated, and option D oil retention. So option C medicated is correct answer. Question number 239. A nurse manager prepared the unit clinical operation plan. So what is the top priority in the plan? So option A infection control, option B staff orientation, option C quality project, and option D safe patient care. So option D safe patient care is correct answer. Question number 240. What is the characteristic of democratic leadership style? So option A more chances, option B structured work, option C staff participation, and option D no leader decision. So option C staff participation is correct answer.